Right from here, you know, the first thing we said is that you have to learn how to palpate to know your landmark. How would you palpate when your patient is lying down? Two ways. You can take the lowest rib, this is my lowest rib, and you follow it to my back. So you follow it to the back like this, right? And then you look for the next spinous process. It should land you on T12. Then you can come to, this is the lowest rib actually, not the one I'm touching. This is T12. It will land you on the T12. Then after that, you know you're on L1, L2, L3, L4, L5. There's one thing that is common to the spinous process of the lumbar. Do you see them? Very flat, not sharp, flat. Then when you come to the sacrum, it's like zigzag, zigzag, zigzag. That's how the sacrum is. We need to know that because we're going to be pushing on that. Then what, if you don't want to use that approach, you can look for the two dimples. You can look for the two dimples at the back. That's about the level of the second sacral vertebrae. If you go above it, you will pick this one, which is X1. And if you go above it, you'll pick L5, L4, L3, L2, and so on and so forth. Different approaches that we're going to use. Are we good with that? Please, I want us to take note of that. Or you can use iliac crest. You understand? You can put your hand on the iliac crest, trace it backward, and that will land you on the junction between L4 and L5. So you get that line. If you move above that line, you get L4. You move below the line, you get L5. We have talked about this. We're just revising it. The other thing I wanted to take note of is the facet joint, right? Right? You know, I told you in the last class, unlike in the cervical spine, how did we do to locate the facet joint? We draw the muscle to the spine and start manipulating. In the lumbar spine, the muscles are very bulky. We just kind of make a kind of rough estimate. 1 thumb breadth away, roughly should land you on the facet joint. But I said provided that your hand span is the same thing as the hand span of your patient. If my hand span is bigger than the hand span of my patient, if I put 1 thumb breadth, it will be here. But if my hand span is the same, if I put 1 thumb breadth away from the spinous process, it will be exactly on the facet joint. And I said you should also take note, the facet joint is not exactly at the center of the spinous process. It is slightly below. You will get used to all these things with practice, okay? It won't be a problem to locate spinous process or facet joint. Are we good? Now let's look at some movements. This is very important. A patient that has pain, let's start, because I want us to go with my slide. The first techniques we're going to demonstrate will be general techniques. Then we now look at mulligan, the simple mulligan, thanks God for mulligan. Then we now look at the complex serious. Serious is more complex for lumbar than the other technique. Now, if a patient is having pain, maybe there's impingement on this side. What side is that? Left side. Osteophyte, or disc is protruding, or the ligament gets hypertrophied. Something is blocking the joint on the left side. How will the patient walk, guy? Will he bend to that left side? No, he will bend to the right side. Do you understand? He's gonna bend to the right side. He will be doing 3D movements. A bit of flexion, because flexion protects pain. Side flexion and rotation to the good side. And then the back side will be like that. So how do we manipulate? When you want to, what is the rationale for manipulation? How do we go about manipulation when you are using general technique? You want to reverse all those movements. You now want to take the spine back into flexion to the back side. Are you with me? You want to do flexion to the back side, do side flexion to the back side, do rotation to the back side. Now, this is the back side. The patient is walking like this. Do you understand? Now, you want to do general mobilization, not manipulative thrust. General mobilization, you want to reverse that movement. You want to do flexion here, do side flexion, and do a little bit of rotation to the side. Is that clear? Any question from here before we manipulate? I want to give you the, yeah, go on, madam.